The Delta virus is attacking the unvaccinated, including children, especially those less than 12, since we don't have FDA authorization yet to get them vaccinated. Last week, about 100,000 children got coronavirus, which is 15% of all new cases, and up by about 30% from last week. But the real question is this more deadly? And do kids get sicker? And the answer is, unfortunately, it's a little bit too early to tell. Most likely, the children are not going to get sicker, at least in adults. The Delta variant doesn't seem to make them get sicker. It just means it has an increase in the number of people who are getting sick. And as you know, with children, less than 2% of children get hospitalized, and the fatality rate's very low. It's 0.03% overall for all kids. But the challenge is this, is that children live often in multi-generational households, and also they're living with their parents, and they may be around other people who might be immunocompromised and who are much more susceptible to get severe COVID. So the issues around school reopening, of course, are challenging because you have to balance both the issues about appropriate learning for children and the rise, as we know, in stress-related and mental health and behaviorally related problems that kids have been having during the pandemic, staying at home, with the issue of children bringing the virus home. So we don't think right now the children are going to get sicker. They're just more likely to get sick with Delta. We think that the COVID cases in the Bay Area will probably peak sometime in August or September. And this is, of course, assuming that we don't have another escape variant or another escape mutation. In San Francisco, this is because about 70% of all residents have completed the vaccination series, and that rate goes up by about to 78% if you look at people over 12 years old who are eligible for vaccination. So we're very lucky. We're living in an area where the vaccination rates are very high, and we know that's the number one thing that we can do, in addition to masking, then social distancing, that's going to really help us in terms of bending this curve. So the infection rate's dependent on the number of susceptible people and the maneuvers they take to protect themselves. So the breakthrough infections we're seeing with among the vaccinated is going to be lower, and those people who are having breakthrough infections are not as sick as they were before, and the death rates are decreasing. So all of this is good news, especially because I think San Francisco people have done a very good job of being responsible citizens and trying to take care of themselves and the communities through vaccination. So very recently, we had an observational study that came out of Mayo that studied about 50,000 people, people who were 25,000 of which who were vaccinated and 25,000 of whom were unvaccinated. And they tested positive by PCR for COVID-19. And the investigators had done a study taking a look at the rates between those two and matching them for age and for gender and for their full vaccination status. And so what they found is that of the two available mRNA vaccines in the United States, Moderna seemed like it was much more effective against the Delta virus. So initially, for instance, Moderna's infection rate against Alpha variant, not the original one, was about 86%. And then in July, as the Delta virus in Minnesota became much more prevalent, it was about 70% of all of the cases. The Moderna had a 70% effectiveness rate against getting sick. The Pfizer vaccine initially in January was 76% effective against getting sick. But over that same time period from January to July fell to 42%. And but this is just against getting any illness. But the real question is hospitalizations. And we know that both of these vaccines are fairly effective against hospitalizations. Initially, Pfizer's was about 85% and Moderna's was about 92% for Alpha variant. And it's dropped somewhat with Delta, but it's still in that same range. So any vaccination is better than no vaccination, I think is the number one message. And the second is, as you know, hot off the presses, the FDA has now approved a Moderna booster for people who are immunocompromised. So that's about 3% of the United States population. So people who have cancer on immunotherapy or chemotherapy, people who have solid organ transplants, or who have something that puts them at very high risk to be able to get severe COVID. So the good news is that the vaccines are still effective against the thing we care about most, which is hospitalizations and death. And also we're in the process, I think, of seeing boosters approved initially for those people who are the sickest among us. And then hopefully eventually, if it's shown to be effective for those people who are maybe not as sick. The issue with the immunizations for those people who are sickest is that they may have an initial ineffective response to the 2-dose regimen. So the third dose seems to make a difference, both in terms of their immunoglobulins, which are proteins that the body makes to fight infection that stick around for a while, and the cellular response, which is the memory cells, B cells and T cells that will fight infection and get activated to kill a virus or bacteria once the body recognizes the infection again. So the third dose seems to be very helpful for those people who are immunocompromised. Any mask is better than no mask. As we know, the virus itself is less than 0.1 microns and travels in particles that are about 0.3 microns or so. The KN95s and N95 masks are the most effective at filtering all of those out because they're respirators and they fit completely over your face. And you have to really do a seal test to make sure things are fitted properly. And then after that, the surgical masks and the cloth masks are less effective at filtering out the tiny particles, but certainly any medium to small droplet, not the micro droplets, will be filtered out by a good surgical mask or a cloth mask. Now, for the cloth mask, the thing that makes a difference is the tightness of the weave and also the number of layers that you have. So the more layers you have for the cloth mask and the better it is fitted around the face, the more likely you are to have a decrease in any droplet and aerosolization transmission. It's not going to get the tiny particles, but it's going to get the majority of the medium and large particles. When you have a cloth mask or any other mask, the major thing is fit. So if it's below your nose, if it's having leaking, if your glasses fog up when you wear them, the mask is not well fitted. And please adjust your mask so that you can make sure you're protecting yourself and protecting your friends and family as much as possible.